The first GLP-1 drug received FDA approval for type 2 diabetes treatment in 2005, and since then demand for the drugs has skyrocketed. In recent years, GLP-1s like Ozempic have surged in popularity for their weight loss benefits like appetite reduction. But these drugs don't come cheap. Thanks for staying with us here at 10:30. I'm Brent Harden. Nearly 20 years later, one nonprofit reported about half of U.S. adults who take GLP-1 drugs say they are difficult to afford. State lawmakers say they hear the complaints and they have a unique idea to bring down the cost. Fox 61's Celine Arif explains.
In order to get your hands on a GLP-1 like this, you will need a prescription from a healthcare provider. But not all insurance companies cover GLP-1s for weight loss, so just a month's supply could set you back hundreds or up to more than $1,000. Might not look like much, but the amount of GLP-1 drugs you see here comes with a heavy price tag for pharmacies.
Like $20,000 easy.
It's a problem pharmacists and lawmakers like State Senator Matt Lesser say can't be ignored.
The cost of GLP-1s is very high, and we know that the demand out there is enormous. You know, we have an obesity epidemic in the country.
Some of the insurances pay for everything, including the weight loss or a type 2 diabetes. And some of the insurances have a restriction saying that is like, oh, it's only for the type 2 diabetes, not for the weight loss. Weight loss is considered as a cosmetic.
That's why when Governor Ned Lamont signed the bipartisan drug affordability bill in July, lawmakers included this provision.
What we're trying to do is get permission from the federal government to go and work with a generic drug manufacturer to make our own Ozempic or another GLP-1 to say that they are going to set aside the patent in this particular case.
Tackling the health crisis and making history by finding a workaround what many call big pharma.
The federal government has threatened to, and states have threatened to do it before, but we're further along than any other state has ever been.
Hartford pharmacy owner Praveen Dulipala says he's seen firsthand how much these drugs have given his customers their health back, and he hopes that something like this could give even more of his customers the tool to help them manage their weight.
If the insurance is not covering and the person cannot handle it with the $1,200 or like maybe $1,000 a month, and they cannot get it, it's not fair.
Lesser says the next steps are reaching out to the U.S. Secretary of Health and Human Services, Robert F. Kennedy Jr., about greenlighting the idea and then working with a company to get FDA approval. Reporting in Hartford, Celine Arif, Fox 61.